Assalamu alaikum. I hope you're all doing well. Thank you so much for those who have subscribed and those who have left warm comments on my channel and all your support. Thank you so much. Today I would like to make just a small video on advice for new moms. So if you have someone who is expecting in your family or you're the one who is expecting, congratulations, and you are going to get this amazing gift from Allah subhanahu wa ta'ala, and just you will see how nice your life will become after you get the baby. So first of all, my first advice would be don't get surprised if your routine will change, and you will have to change your priorities around the baby, and you will have to rearrange your own time. But don't worry about it. At the beginning it might be a little bit overwhelming, and you might think that everything is getting out of your control and you can't really do much about your life, but it will take at least 3-4 weeks until you get into the normal routine, and you will start feeling better. So this video will be about my own advice and my own experience for new moms, but if you have any more concerns, please double check this information that I have with your doctor, just to make sure that you're doing everything right. During very first days of your baby's life, you will see that a lot of family members and friends will want to come and visit you. Everyone will want to hold her and touch her and just be happy about the baby. But my advice would be that you should be careful and see who is handling your baby. Especially you would need to be careful about small babies, since your baby does not have any immunity at the moment when they are born, or their immunity is very low. Allow everyone to hold your baby, but maybe not kiss or touch their mouth area, and ask them to sterilize their hands as well. I know that there are families who do practice that, and if nothing happens, but I was extremely careful about my baby, and alhamdulillah she's 6 months now and she never been sick because I've been overprotective, and I think that's worth it. Another thing you will notice that your sleeping pattern will change, that your baby will be waking up every 2 to 3 hours to feed. That is normal, and you should readjust towards it. I know it will be difficult. If your baby does not wake up every 2-3 hours, my advice would be to set up an alarm and feed them. Don't worry about very hectic sleeping pattern at the beginning. Usually at 6 or 8 weeks, your baby will wake up only once a night and you will get some more sleep. If your family member or your friend had a baby, try to help them out as much as you can. Maybe you can make food for them. Maybe you can come and release them for a few hours, or just an emotional support would do as well. When you just had a baby, very first few weeks might be very overwhelming. You might feel baby blues, you might tear up, you might start feeling depressed, but don't worry about it, it will go away. Try to surround yourself with people who support you, who love you and who care for you. Now, a few things about baby's body. To avoid nappy rash, I would suggest change nappies frequently. Don't necessarily use expensive nappies for at least 2 to 3 weeks of their life. Is okay, everything? Right? Everything is fine? I always used to change her nappy just before I feed her, especially during the night. Then because your baby tends to fall asleep when you feed them, you don't have to wake them up again. I know some women don't change their nappies during the night, but I just couldn't leave my baby without changing a nappy, because I feel that it might be uncomfortable for them, and it might cause a rash as well, so I think it's best to do that. Always wash the baby if they had a poop, because some ladies use wet wipes, but I think it's better if you wash it up and it's more hygienic. If you're alone at home, if you don't have anyone who can help you to clean the baby, you can just do that in the sink. I have discovered that, and it's really simple, easy, and you're not scared your baby will slip from your hands. Always use nappy cream. I have bought a pseudo cream just about this size box. I think it costed around 9 to 10 pounds, but it lasted me for 6 months. My advice would be not to use baby powder because baby powder tends to dry baby skin out. You will notice on the second or third week of your baby's life, your baby's skin is peeling off, and that's absolutely normal. They will lose the skin from their fingertips to their eyelids. Everything will go, so don't worry about that. My midwife recommended me that I shouldn't put any cream, and that will help baby's skin to fall off quicker, but I just couldn't allow that to happen because I thought that it might feel very uncomfortable once your skin is dry. So it took a little bit longer for her to change her skin, but I think it was worth it. I was using baby oilatum cream, and I'm still using it, and it works better. Don't use any soaps for at least 2 to 3 weeks, because plain water will help just fine. Baby's skin is very sensitive during those few weeks, so it's best not to irritate. I also wouldn't recommend using any sponge for at least 2-3 weeks as well. My mom advised me to use small cotton balls and put in baby's ear just to avoid ear infection during taking a bath, because they might get some water into the ears and it might cause an ear infection. What happened? One more? Thank you. Thank you. I don't remember the reason, but my midwife advised me not to cut baby's nails for at least 2 weeks. For baby's umbilical cord, you may wash it 2 to 3 times a day with warm water. And when you put the baby's nappy on, try to fold it so that the umbilical cord is not covered by the nappy. This way it will dry out quicker and it will fall off quicker. You must call your doctor if you see any green or yellow discharge from umbilical cord, because it might have been infected. Try to keep your baby as much as you can in the daylight, just to get that enough of vitamin D and avoid sun. I know that some of us live in not such sunny countries as UK, but daylight will be fine. You not necessarily need any sunlight. Keeping your baby in the daylight during day, it's also very useful in building baby's routine. I've tried doing that and it really worked very well. I always kept volume up, and I did not dim the light down during the day when she was sleeping. I always tried to show her that this is the daytime, and when evening comes I would dim the light, I would put the volume down. I will speak very quietly so that she knows that this is the time to relax, and this worked perfectly. I would recommend to always have all baby's medicine that you would possibly need at home. I always had paracetamol, nasal drops, nasal aspirator. Please look up for that on internet, because nasal aspirator has been so helpful for me. It helps to clean your baby's nose since they cannot blow it out, and nasal drops don't really work. Don't worry if your baby starts crying when they are about 2 to 3 weeks, every day, all day. That means that they are experiencing colic pains, and you should look out for colic pain relief medicine, and it will help, inshallah. For the colic, I would recommend Infacol or gripe water. It was perfect for my baby. If you don't live in UK, you can buy it on Amazon. I will write the names of the medicines that I've used in the description box. I think it's very important to speak about SIDS, which is sudden infant death syndrome. To avoid that, always put your baby at the end of the Moses basket or at the end of the cot. Always avoid loose bedding and any pillows for your baby when they are so small. This will help your baby to have enough air around their head. To avoid babies overheating, don't put baby's hat on in any case. Does not matter how cold it might be. Always Leave the heater away from the baby. Don't keep them direct next to the heater because they might overheat. Dress baby in as many clothes as you would normally wear. They don't need more clothes than you do because they will overheat. Never let your baby to sleep on the tummy. I know some of the moms do that and nothing happened to their baby. The babies cannot control their head very well, and if they turn their head on their nose, they might get suffocated. I always try to avoid taking my baby out after the baby's bath because they tend to get sick and catch cold very easily. Try to exercise your baby just to help them with their movement. Well, if you want me to show you how to exercise your baby, let me know. Leave the comment below because I'm not sure if any moms are watching or if anyone who is interested in this kind of things are watching my videos, so please let me know. Try to join any mommy's club that you would have around your area because you will be feeling a little bit depressed, maybe a little bit lonely, and you would need to speak to other moms and see what they are experiencing, what their advice would be, what they have discovered. So that is very, very important. Another thing that will be very hard for you to deal with the housework during the first few weeks. So try to freeze the food or try to ask your friends. Don't be shy to ask your friends or family to bring food for you and help you out. If your baby is constipating, don't worry about it. Try to give them some chamomile tea. It really helped for Myra. And if they don't really like the taste of it, so try to feed them with the syringe, obviously without the needle. Always try to burp your baby before you put them to sleep. If you don't know how to do it, I will just try to show you. Basically, take your baby like this and just gently tap on their back or gently stroke